Shoulder replacement surgery is essentially where you change the ball and socket in the shoulder. The ball has become irregular and rough, and so has the socket. And so these are changed where the ball is changed to a metal ball attached to the humerus, which is the arm bone, and the socket is resurfaced with a plastic smooth surface. That's a conventional shoulder replacement, but increasingly now reverse shoulder replacement is something we do, and that means that we change the socket for a ball and the ball for a socket. Typically, patients would stay in hospital for a night and go home the following day with a sling when you're comfortable, and start some gentle exercises to the wrist and to the elbow and minor ones to the shoulder. But the shoulder exercises don't really start in earnest until the sling comes off at around about 4 to 6 weeks. After that time, physiotherapy will increase your range of motion and increase the strength. And you can expect to see improvements in that up to 6 to 12 months. By approximately 1 year, about 95% of patients are noticing no pain and good improvement in movement. In Spire, we have a dedicated team to prepare you and to look after you during your journey through this surgery. This sort of surgery is an enormous moment in your life, but for us, it's quite routine. And that's not to belittle it, but it's just to say that we're very used to doing it and we'll take good care of you.